She will be moderating the panel to give us the context behind the topic of discussion.
I'm not going to say good morning again, as I did the first time. I've been well and truly reminded that it is now afternoon. Okay. I've been well and truly reminded that it is now evening. I'm going to provide a bit of context to the topic for the panel discussion, and it's data and digitalization and the role it plays in helping us to achieve universal health coverage. But before I do, I realize that some of you present here might not be very familiar with Avon HMO. So I'll introduce us very briefly. We are Avon HMO. Avon Health is Dr. Sola Pitan. He's the medical director and CEO of Orile Agege General Hospital. With expertise in health policy management, he has held various leadership positions in the healthcare sector. Previously, he served as the Deputy Director of Medical Services of Lagos State Health Service Commission. He is also the Senior Special Assistant to Lagos State Governor on health matters. He has extensive experience in coordinating collaborative efforts amongst healthcare stakeholders and in implementing quality initiatives. He has qualifications in health policy and management and has worked in clinical and public health roles, including at the U.S. Center for Disease Control and Prevention. Welcome, Dr. Pitan. Thank you. I'll call on Dr. Adedamola Dada. He is the Medical Director and CEO of the Federal Medical Center, Ebutemeta, in Lagos, Nigeria. He has played a vital role in transforming the hospital into a leading institution known for its quality service delivery and clinical innovations. Dr. Dada has received several accolades and awards, including for his outstanding leadership and contributions to healthcare, including being named the Public Hospital of the Year in 2021. His hospital being named. To be quite frank, I diverged from reading his profile, but his hospital has a phenomenal reputation. You will notice that our panel will be a mixture of public sector healthcare leaders and private sector healthcare leaders. We recognize that most Nigerians use the public sector healthcare facilities, and if we are to make a difference in the healthcare sector, we need to not only profile them, but we need to listen to them and make sure that they are contributing to the discourse and whatever policies we are coming up with. So I will call now on the next speaker. I beg your pardon. Dr. Akinbiyi. Dr. Akinbiyi is from the private sector. He is the acting CEO of Avon Medical's practice, also a subsidiary company within the Hayes Holdings Group. Graduated 24 years ago from University of Ibadan, Nigeria, with a Bachelor of Surgery and Bachelor of Medicine degree. He later obtained a master's degree from the University of Manchester, UK. He had 6 years clinical experience and 18 years in healthcare administration and leadership. An effective leader with a track record of notable achievements within the healthcare sector. He's passionate about data management, technology, and automation in the healthcare space. At Avon Medical, he drives the key areas of business success, including customer care, patient experience, operational and clinical excellence, and outcomes. Please welcome Dr. Oke. Last but not the least, I'm going to call on the only other lady to join me on this panel. With much pleasure, please join me in welcoming Annabelle Neame. Annabelle Neame is the Assistant Vice President of HCA Healthcare, UK New Markets and Innovations. With over 30 years of experience in healthcare, she has worked in clinical practice and in management in both the NHS and in the private sector. Annabelle is dedicated to improving the patient journey and promoting the UK as a center of clinical excellence. She values collaboration and has built strong relationships across various stakeholders, including healthcare providers, patients, insurance companies, and government organizations. Annabelle has a deep understanding of integrating the public and private sectors for the mutual benefit and improvement of patient services. Thank you very much, panelists, and welcome. What we've tried to do with the panel is to ensure that we have representation that adequately covers the whole, ecosystem of our healthcare sector in the country. So we have our regulator here. You're most welcome. We have an expert from one of the big 4 consulting firms. You're most welcome. We have our 3 panelists from both the private sector and the public sector. You're most welcome. And we have Annabelle from HCA giving us the international flavor, a perspective beyond our shores. Annabelle, you're most welcome.
Thank you.
So I'm going to lead right into it right now and start with the first question. And this question is for all the panelists. In order to reveal patterns, problems, and evidence for action for use by public policymakers, both within the private and public sector, we need to make significant progress on the use of data and data analytics, as well as digitalization in the healthcare sector. What are the areas you think we should focus on in trying to use data and digitalization to accelerate universal health coverage? And this is a question for all the panelists. So I'm going to start from you, Dr. Oke, and work my way around.
So in the journey, looking at the journey to data, EMR it's one of the things that have revolutionized digital revolution in the digital and the health space. And one of the things we have EMR has been the digital revolution in the health space, and that is one of the things we use in the health sector space. And for us at Avon Medical, it has been helpful in making important decisions in helping the patient management to prevent delays in the coordination of care, and collaboration between the healthcare personnel in providing quality health care to our patients. Because we have an application that looks at the customer journey from start to finish. If I want to look back to my training in school, I remember those days when we had to use paper records. And the UCH had a very large records department where paper records are kept. But this has happened, there's a lot has happened in the last 24 to 25 years since I graduated. And my very first experience was at one of the leading hospitals in Lagos when I visited one of my colleagues. And then that was the first time I saw her. She was consulting using a computer. I was wondering, what are you doing? The additional, my other journey is when I was in the UK, when I had to take up a 6-month role to transform medical records in paper form to digital form. The EMR has definitely transformed the way we manage patients, and there's still a lot ahead for us in the space.
Thank you very much. So same question for you. What should we be focusing on when we say data? We need some, yeah. When we say data and digitalization in the healthcare space, what should we be focusing on?
Good evening, everyone. I think there's a lot that digitalization has done and it's continuing to do for us in healthcare. First of all, I think we've come a long way, just like the last speaker said. And I'll say in the last, perhaps the last 5 years, there's been a lot of movement. Initially, it was all a lot of talk, very few private hospitals beginning to adopt electronic medical records and looking at how they can integrate it into their existing systems. Now we have bigger hospitals and we have public hospitals adopting them. As at the last count, I believe close to about 14 or 15 of the 28 general hospitals, Lagos State-owned general hospitals, have already implemented electronic medical records. And I think about another 5, 6 will soon come on stream over the next 2-3 months.
That's impressive,
yes, because the Ministry of Health is doing a lot, trying to work with partners, global health funds, to fund the provision of both the hardware, the networking, and everything that is required. Some of the hospitals have taken the initiative on their own to implement. And part of the reasons are that it's helped to simplify the patient's journey. It's helped to improve the access to the records of the patients. It's almost an instant access. You see a patient in your general patient, and now the patient has to go to the pharmacy, the lab, radiology, and the information needed at all those service delivery points, they are made available in real time at those points. So it reduces the turnaround time, first of all. Once that happens, of course, you also have the issue about loss of records. That has been the bane of hospitals, especially public hospitals. I know it happens in very many hospitals, but public hospitals, because of the large patient load that we have to deal with, we struggle with all those challenges in the past. You have papers in those files, and something tears out, is missing, and so you've had different things, including different treatments given to different patients, as happened in the past. All these have reduced. So the quality of the service you are giving to patients have obviously improved, and it's going to continue to improve. Now you have things like telemedicine that can get tagged along with this. Some of the hospitals that have implemented EMR have not started deploying those aspects, but then it's coming because some of the platforms we're using already have that, yes, they have the abilities just to now begin to implement them. The other thing has to do with how you use the information that you are able to get, the data. You know, data is a new gold as we talk about it. You are able to study your systems, look at the type of patients, look at the mobility patterns, for instance, and begin to know what to prepare for. Yeah. Your procurement process is better guided, for instance, you know. So many other aspects. I don't want to take all the points, but then I'll leave the rest of the panel to talk about it. Thank you.
Thank you. I'm going to try and project my voice because I can see the mic is not doing that for me. So I'm going to turn now to you and to say that what areas, when it comes to data and digitalization, should we be focusing on as a country?
Thank you, Mr. Chairman. As in NHIA is building the infrastructure, by the mandate that we're given, we're to promote, regulate, and integrate data in the health insurance sector. So when we are looking at how do we do this, under the leadership of my DG, who you saw recently, we activated the NHIA. And before then, what we did is that as a regulator, we have to bring all stakeholders together. We are regulating the health insurance ecosystem, so we need the people as with technology and as well as data. So you cannot do that without bringing them up together. He came in under and developed a 10-year strategic plan, and one of the key outputs from there was the health insurance under one roof, whereby health insurance will come together and then we have the same regulating policies, technology-driven. And so on the NHIA, we have been able to automate health insurance business. We have also been able to interconnect with various state offices, and we're also having legs, channels by which state health insurance can join HMO and ACP for data interoperability. So we also ensure that we have a mechanism as the regulator by which we can address grievances by enrollees. As you all know, our clients are the enrollees, and we take care of their interests. So we address their grievances, we also give them feedback and support, and we also develop another component. They're making 4 components now, the identity management. One of the critical areas that we met was that there were serious identity management that could lead to identity theft here and there. And how did we do that? I don't want to take much time, but I'll just mention that we built a database that had to be harmonized with NIMC. NIMC has the identity management solution through Neame. So we did not develop a separate technology for that. We harmonized and integrated our database with NIMC to ensure that before you enroll into health insurance, you must have a name. So by that, we have been able to reduce, and we are still in the process of cleaning our database. Because whatever it is that you're going to do with data analytics must run on clean data. That's very essential. So we build that foundation, and as we go on, perhaps I'll mention other. Let me just stop here.
Thank you. So over to you, Annabelle. From your perspective, coming from a much advanced and developed country with a healthcare ecosystem that is more sophisticated than ours, not without its problems, of course, but still more sophisticated than ours, what would you say to us? What areas should we be looking at?
First of all, good evening, everybody, and thank you so much for having me. It's an absolute honour to be here with you all today. I'm going to take it all the way back to basics, actually. I don't profess to be an expert on the Nigerian health systems. I've dipped in and I've dipped out, but I have spent over 30 years in the English healthcare system, and you're right, we're not without our issues. But taking it back to all the things you spoke about, I agree with absolutely everything that you've all said, actually. But really, the most important thing with this is for me anyway, is the data collection and the data integrity. Without that, none of these fancy systems will work at all. And in my experience, that has been the hardest thing to deliver. Data analytics in itself should really give an accurate picture of what's already happened in the past to help extract information and patterns to give insights on improvement for things such as patient safety, or how to make more profit, or how to improve ICU care. I mean, I think you need to know what you're focusing on before you even start that. So I think the data needs to be of a really, really high quality. It needs to be accurate. It needs to be reliable. It needs to be comprehensive. You know, we have an expression, rubbish in, rubbish out. If the data is rubbish coming in, you're not going to get any insight whatsoever. You may as well not have it. In fact, it's even worse, because you may be really misled into believing something that simply isn't the truth. But also the formatting of the data and the systems. If the systems don't talk to each other, again, you've got a really big problem. And these are all things that we've had issues with myself. I've been involved in the implementation of GDPR, which I'll talk a little bit later without trying to bore you all too much about it. But also we are currently at HCA implementing across 8 hospitals in EHR, so we are a little bit behind some of the NHS trusts. And boy, is it difficult. You know, we've had to employ an extra 300 technical people to do it, and it's going to take us 2.5 years and £100 million. So it is a huge undertaking, and we've just started the process now, and it is really almost overwhelming. But the benefits, I think there's going to be some pain, but the benefits, I think, will be absolutely amazing. And just again, if we're looking at health as a global issue, which for me it is, I'm passionate about health equality and, well, passionate about the health inequalities that are currently in play. If everybody can get this together, we've got so much to share, and I really believe that every patient in the whole world will benefit by us all putting these systems in.
Thank you. Thank you very much, Annabelle. I move to you, Dr. Dada. Same question. What exactly should we be focusing on?
Well, thank you very much. First, let me thank Avon for inviting me and virtually taking almost half of the day. I'm not complaining.
Thank you. Thank you.
Yeah, very important issue. You know, I always like to approach this from the situation my institution was in about 5 years ago. Yes, and by the way, if you will let us blow our trumpet, I'm sure you know that we're the first public hospital in this state, okay, who completely became paperless, all right, and maybe even...
That's why he's here. That's why he's here, sir.
And over 40 institutions, including the 12 or 14 that my junior brother, Dr. Pitan, talked about in Lagos State, actually came to understudy what we had done and done successfully for the past 5 years. Led us to starting that journey at that time was that, you know, it was pretty obvious to us that without the use of technology, extremely very difficult. To be extremely very difficult to deliver any source of reasonable and responsive health care to Nigerians. The usual challenge at that time was that a patient will come into the hospital and then the patient is still there 2 hours. He has not been seen by the doctor. Not that the doctor doesn't want to see him, but the patient's case note cannot be seen after 2 hours. And in frustration, of course, you know, the previous note is lost. In frustration, you ask that another case note be opened for the patient, so he has a temporary case note. It comes again in another 1 or 2 weeks, and both the original case note is lost and the temporary case note is lost. Okay, so, you know, identity management, information management, quality of service, accessibility, you know, all right, and even the finances. Okay, if you don't digitize, then you find out that at the end of the day, you're just pouring money into an open basket. Okay, and you can't actually plan also. You have no data to plan and all of that. So those are the problems that we faced at that time. And for me, to answer your questions, those problems still exist today in virtually all the health institutions, okay? And we just found out that the best method that we can use to actually solve the problem was to go digital and to use technology. Of course, nobody had done it on such a large scale. You know, you can talk of the private hospitals who see maybe 50, 60 patients in a day, all right? I see about 40,000 patients in a month.
Wow.
All right, so to manage that data, you can, all right, but we realized that that was the best and maybe, you know, the cheapest and the fastest method for us to be able to actually access this. And that was why we went into that journey, okay? And experience over the last 5 years and the results we have gotten over the last 5 years has shown that that was the right decision to actually take at that time. We manage our patients better, okay? We have better access to our resources. We have better planning, all right? The quality of care that we give has tremendously improved, okay? And the patient's journey has become a lot seamless. In actual fact, we also engage the HMOs like yours better, okay? We have better records, and so we are able to squeeze your neck and say, no, this is what our record says. You have not paid us. And the same thing with NHIs. All right. So it's something that I think we need to embrace. Okay. We need to encourage others to start that journey. Those who have not started. Okay. And it's the way to go.
Thank you. Thank you very much, Dr. Dada. I'll now move to our expert. from one of the big four, from Ernst & Young, what do you think we should be focusing on when we talk about data and digitalization for the healthcare sector?
Thank you, and thanks for having me today, and good evening, everyone. I think a lot has been said from the experts as well. I'm just a consultant.
Technology expert.
Okay, so I think we need to look at telemedicine and remote care, because universal health care really is about, universal health coverage is really about ensuring that everyone has access to health care. And then not just that, everyone has the right complement of services and quality. You can see I'm trying to emphasize not just healthcare, but the quality of healthcare. And also in getting those services, you can afford them. They're not a financial burden, or will not create any kind of financial hardship. So to that extent, there are some people that are not in Lagos, that are in remote areas, rural areas, that don't have the kind of access that we all have here, whereby they cannot see a doctor, they cannot go to a primary healthcare center. So to that extent, technology is going to drive access. But then there are also impediments to getting that access. Internet, do they have the internet to be able to see it, get a doctor attend to them in Lagos? Is the internet strong enough? And then how do you then assess the quality of that service that is being given to them from someone who is in a, like a Lagos? What's the quality? And then what's the safety? And what kind of ethical standards are behind that kind of service that is given to that kind of, patient? So that's one. Telemedicine and remote care is key, and technology will drive that. The other one is disease surveillance and response, right? COVID has shown all of us that, every day, I'm sure when COVID started, everyone was measuring, oh, how many people have COVID today? Oh, some people have passed on, some people. It's because Lagos State has the right data, disease surveillance system in place, right? So many other states will not give you that kind of information or data. So you're able to respond better to, disease outbreaks. And honestly, if there's anywhere else to invest in, that area is very key. It helps for data analytics, early detection, and quick response. And that is another area. And indeed, health financing. You've all talked about how it helps you capture, cost and all of that. So it helps in billing. For example, a lot of hospitals, particularly the private ones, and maybe, okay, yes, the public ones as well, many of them cannot categorically say that this is how much revenue they've made. All they know is that patients are coming every day, and they're attending to people. Oh, we have so many patients. But the truth is that in terms of financial reporting, how are you faring? Are you profitable as a business? Many hospitals are not profitable because they cannot capture costs. So also from an insurance standpoint, so in things like processing and reimbursement can be done, when you have technology. Yeah. Maybe the last one I'll say is health insurance, health infrastructure planning as well. It is then you begin to see where to invest in. Now, so for everyone has talked about data, how data is helping, but you need to also know that there's need for certain backup infrastructure like electricity. At some point in time, you start with consistency. At some point, some hospitals have stopped gathering data, which is why she talked about the quality of the data, right? At some point, part of the reasons why some of this information gathering is not working well is that data gathering has probably broken down at some point, and so it's affecting power, internet. Not everyone has access to internet. In fact, some don't even have access to 5G.
Yes.
Right? And then there's the last one I wanted to mention that skipped my mind now, but I think I'll stop there for now.
We'll get to it. So thank you, everyone. And I like this first round of answers. It's shown that everybody on the panel actually belongs on this panel because we've seen the richness of their experience and the different perspectives that they bring into the discussion. We've been made to understand that data collection is key, and data collection, data that is robust, that is accurate, and that is reliable and pervasive for it to be useful. We also see that using technology can help us to take medicine to rural and remote areas. It can reach places where human beings, physical doctors cannot. But I'm going to start again with you, Damilola. And, from your own experience and in your line of work, what solutions or initiatives have you heard about or have you been involved in that you think as a country we should be looking at for our own healthcare system?
Okay, I think first of all, there's need for Nigeria to have a comprehensive national digital health strategy. I know that there's some initiatives around that already, which needs to be built on. There's what you call the National Information Systems Policy. I don't know how effective that is, but I know that it has its own challenges. Because if it has been fully, if it's making the right impact, we will not be here. We'll probably be progressing in terms of using data and digitalization. So that is key. The other one is also data governance. So there's need for data security, data safety, privacy. Yeah. The president just signed a Data Protection Act, I think, about 2-3 weeks ago. I believe that should also try to, cater for data privacy, because I'm sure no one here would like anyone to have access to their health history, medical history, to the extent that even at the highest levels, no one, really likes to disclose such things. And also, there are other...
That will do. We'll come back to you. I'm going to now look to you. This sits right on your table as the head of the Department of ICT for the National Health Insurance Authority. I'm sure many people like me were impressed when he started talking about how much advancement they had made on technology and the use of technology to drive their own goals at the National Health Insurance Authority. And kudos to you and kudos to our DG for having achieved so much. But what are the next steps for you as NHIA in this area?
Thank you. Having started with the health insurance under one roof and the need to automate the entire ecosystem for data exchange and service improvement, and also to derive data-driven decisions on a clean data. The next step is actually what has been done by the federal government of Nigeria. That's the NHIA Health Insurance Act of May 2022, Act 17 of May 2022. Encompassed in this act, first we need to promote, regulate, and integrate health insurance business in Nigeria. We need to get the volume. We need to get the volume in that also NHIA has been said that we should drive the mandatory health insurance policy for the federal government. Now we look at it, that's how do you make health insurance attractive and mandatory? You must have a very good basic health insurance package, benefit package. And so the government came up with basic healthcare provision fund, with which we are going to drive that every Nigerian, all Nigerians will have access to healthcare to the basic minimum package. And again, we have to provide the technology for this to host all of this. Also, the government has said we're going to enroll the vulnerable group. So how do you cater, how do you get them enrolled? You must have a technology that digs deep, cuts across, that's the essence of the health insurance other one rule, because all sectors are involved, from federal to state social health insurance agencies and even to private health insurance agencies. We are now under a roof, and then we are sort of under a data fabric to ensure that whatever data exchange we are making there, just as he pointed out, data integrity and data security is upheld. Again, we look at the aspect of whereby, I'll give an example, a practical example to justify what we have done. What you have here is GIFSHIP, that's Group, Individual and Family Social Health Insurance Program. It didn't just start as GIFSHIP. It started as VCSHIP, that's Voluntary Contributory Social Health Insurance Program. We discovered that it was a program at VCSHIP designed to penetrate the informal sector.
Yes.
But over the years,
no penetration.
No penetration. So what do you do? How do you get the data? How do you do service improvement? So under the leadership of my DG, we came together and looked at the pros and cons and said, look, we are not opening up this enough. We've not developed a robust healthcare package that will take care of groups, families, and the individual. So this was brought up because we had the feedback from an existing system and we are improving upon it.
Thank you.
So our next step really is to get the volume.
The volume,
yes.
The volume. And technology will help you to get the volume. Okay. Now, I'm going to move to you, Dr. Pitan. I mean, you know, it's part of why we wanted a panel like this was because we wanted adequate representation from the public sector. Ever so often, when people gather, especially within the private health sector, to talk about what the country needs and how to move the sector forward, you don't have enough participation, and the voice of the public sector healthcare facilities is often not heard loud enough. You've shared with us what you're doing at present. It's impressive in Lagos State. I know that Dr. Dada is on the federal side, being CEO of a federal medical center. But Lagos State is a powerful state. It's a state with resources. So please tell us, what are the challenges you faced in implementing even the level of digitization that you have achieved in your own facility and in other facilities in Lagos State? And what are you doing to overcome them?
Thank you very much. Let me start by saying that, well, I'm proud to be a protege and a learner, a big one, from Dr. Dada. If you identify excellence, I think it's best to go after it. So I've been able to not only go to his hospital to tour the place, to drag him to my hospital to speak to my leaders twice. So I think it's something that he's doing a fantastic job, and we are racing after him big time in Orile Agege General Hospital. Well, a lot of challenges, yes. The first, of course, is the financing aspect. You know, how do you get the necessary funding for adoption of electronic medical records and every other thing related to digitalization of healthcare? Well, we're a public institution, and typically you would wait for government to, you know, find the money. Now they are, at the Ministry of Health, they are looking into working with partners. I mentioned the Global Fund. They're also looking at other partners to help. But many of our public hospitals that are big enough have taken the initiative to adopt some of these EMR platforms. And we have looked for different ways to finance it, including pay-per-use, you know, which is what we have done in Orile Agege. And it's been easier for us to ask a patient to just pay 200 naira, you know, when they come to access health. And so it's made it easier for us to be able to implement. And we've been implementing all around every department. We've been able to do that. So hospitals can look at that option, because I feel that even some private hospitals are not utilizing EMR platforms, and they should begin to think about, because, you know, you think about the hardware, you think about the software cost, you think about networking costs, you think about the maintenance costs. You know, these are very, very important things. And then, of course, you know, things will get bad, networks will go down, you need personnel to work on it. So there are things to consider. The next is that the next challenge is, of course, the human resource element. One of the things, I'll tell a short story. After working as the SSA to the Ambody administration on health matters, I worked at the Health Service Commission, and in that capacity, as one of the directors, they sent, I was overseeing the medical records sent from all the hospitals. You know, we have a unit that deals with the medical records. They coordinate, and then they send to me. And then I saw a sales spreadsheet without formulas in them. I almost flipped, like, okay, how are you doing these calculations? They know the calculations. They know everything because they were taught in school, the medical records team. Fantastic people. But then they need to get further training. Of course, HSC is now taking care of all of that because I scaled it up that, oh, we need to do something about this quickly. And now there's a whole unit in HSC dealing with data and data quality and all that. I spoke with the director in charge even while I was coming here. So there is movement on that. But then we need more personnel along those lines. We need not just in our School of Health Technology where medical records people are trained, there is now need to introduce computerization and the knowledge about computerizations and how to analyze and, you know, digital analytics and things like that to them in there. We also need biostatisticians. So, well, I'm a public health person, so I know the importance of having biostatisticians. We don't have enough. Thank God some of our universities are now having degree courses in public health, and of course biostatistics is one of those 5 pillars of public health. And so I believe that over time, in another couple years, we'll have more trained people who can at least know what to do when you have data. Now, they need to quickly be scaled up to all the hospitals. Every hospital will need them, you know, so that the data mining, the analytics of the data, and preparing it to make sense for policy decision making is now quickly done. Beyond that is the issue of building the patient interface for all this. And Dr. Dada's team, they've already gone ahead to begin to experiment with that patient interface aspects of EMR. And many of our hospitals are beginning to think out with that. There is so much that our patients can do. Well, we can say, oh, they're not yet educated, but that's just some of them. Others are. If you look at, even compared to the developed world, Nigeria is one of those countries where mobile phone technology has spread wide and round. You know, if you go to the US, there are still parts where they still use the dial, the ring, you know, the ones that you have to, people are still there using in the rural America. Nigeria, you have people now adopting this new technology, and so we can take advantage of that. So we need to do a lot of education for our patients and also help them to be able to adopt some of this technology through a lot of patient education. Beyond that, I think that over the next few years, we will all see that this is something, you know, when Nigeria gets onto something, we quickly, you know, we get on it and we move faster than anybody could think about. So it will now be government trying to catch up, and I think the NHIA is here, and they are also thinking along those lines, because there is so much information that can come from all what we do in healthcare that we can use to do development and to prepare better for managing all our healthcare issues. I'll stop here. Thank you.
Thank you very much. I mean, that's really incredible.
Was about 42 million naira every month, and is expending 42 million. So I had to, like they say in youth, and everybody. So I started asking questions. I was doing the orthopedics they sent me to go and do, but I also put my eyes in other things. I saw vinyl flooring on the floor. You know, what are the advantages of vinyl flooring? So when I became MD, every square meter in the building has vinyl flooring. And people now say, when we first started, how are you going to maintain it? If you see all the distance that was going on, the problem of Nigeria is maintenance. It's 5 years down the road. You have always come frequently. I don't like going into self.
No, but it's good for learning. In fact.
Yeah. So, you know, sir, almost
today, and you are using General Hospital Marina, you're registered there, and then you happen to go to the, you know, yes, or Ibejuleki Beach, and something happens to you, you need to access the hospital there. How do you now get your records, you know, so that you don't have to start creating another records, and so on and so forth. That will be an immediate thing that we need to do. And once that is now done, we now begin to look at how house that, protect that data, and then be able to use it for decision making. I think if we start from there, then we'll take it to the next level. We have not even gotten that right yet.
AI is it for you?
I think, yes, it keeps me up right now. You know, it's something I'm worried about, and not excitedly though, but you know, it's something I'm beginning to think, okay, how do we begin to think of how to integrate it?
And how to bring all the data together
Yes.
in some kind of structured manner.
Yes.
So that all the medical encounters happening in Lagos State, data around that sits in one place, and that is where we layer on the AI.
The Lagos State government has its own plan. You know, they have a base that the Ministry of Science and Tech is already built. They are trying to ensure that all the vendors, you know, buy into that, and that, you know, we move from the local servers. Yes, because, for instance, some of the vendors, they were asking, where do you store? Those who are doing the online one, the cloud version, where is that cloud stored? Oh, it's in the US. So they have an issue with that. And I think it's a fantastic thing for the Lagos State government to begin to think about that, you know, and I think it's in line with what NHIA is also thinking, you know, along with. Because you mentioned something earlier about how, you know, the big pharmaceutical companies.
How back to the point that I hadn't made before about research, let's assume all this is done. I was actually really shocked when I was just reading up a few things about generally around governance in Africa, and I couldn't find an awful lot, to be honest. But I read in the Lancet, this was in December 22, I think actually the pandemic really brought out a few, actually really exploitation of, in particular, Africa. And this, research is obviously always based on competitive advantage. You've got the researchers who want to keep it all secret until they get all the glory for it, and actually they tend to come from high-income countries. And then you've got the pharmacy guys that are just quick as anything to try and make it into some sort of drug or some sort of test, and the people where all the data came from didn't benefit whatsoever. That was the same with monkeypox, and South Africa, actually they were vilified for giving this data over with the genomic sequencing. So I would love to see Nigeria in particular, if we're talking about that now, just really benefit from all the rich data it will have when all these other things have done. I'll be the third one in a row, if you like. Okay. Anyway, thank you.
Thank you.
Well, thank you very much. Again, I go back to base. Okay, I have seen that the adoption of technology and the aggregation of data has helped me tremendously in decision-making process. And so I think that that should be one major thing that anybody who's going to be the minister should tackle. If you call yourself a clinic or an hospital or by whatever name, you must adopt technology. We must be able to aggregate our data and be able to plan with data. What we do now is that we plan in void. We plan with the best guess. If you ask anybody today, he doesn't know the number of malaria cases that we've had in the last 1 month. It's difficult to plan that way. So we must adopt technology, and we must aggregate the data, and we must use it.
Okay. Communications.
I believe the way NHIA went about all these things has to do with stakeholders engagement. What was developed is this health insurance under one architecture. Going straight to claims management, we looked at what is in the works now is setting up a center for claims management, and most of us, some key staff have been to be trained outside the country. Now, how do you ride on AI to automate and bring in some vector algorithm that can easily detect fraud? Because one of the major headaches in claims management is fraud. So you bring in such and you develop it and ensure that we have a national claims management platform that can take care of all form of healthcare benefits, and then stakeholders can key into it. I encourage stakeholders in this sector to also talk to us in NHIA, because we are doing a lot as the regulator. Part of our job is to have a system that can detect and prevent fraud. So we are working on that under the concept of this under one roof concept. Let us harmonize and activate all these functionalities together. It will be for the good of the health insurance ecosystem.
Thank you so very much. Please, a round of applause for my panelists. And we can take away some really strong points. You know, there is a recommendation for data, technology, digitization to feature more strongly in the curriculum in schools, colleges of medicine, and schools of nursing. All health professionals need now to be brought up to date as part of their formal education. Yeah, the latest innovations, you know, to start making them get used to digitalization, data analytics, technology, etc., right from when they're in school. We also have a recommendation for artificial intelligence to quickly be brought to fore. But I dare say that the comment and the recommendation of having all the data brought together under one roof is what will enable us layer on artificial intelligence and be able to do all those exciting things that you're dreaming about right now. In addition to that, we've heard about standards and the need for standardization. We all have to be able to speak the same language. The data has to be collated and what's the word now? Collated and aggregated. Thank you, that's the technical word. Has to be aggregated. For us to be able to aggregate it, we have to have standardized all the terms, all the descriptions, etc. that we use. And yes, we need fiber optics, but we're told that even if we had 55% as it stands today, being only the sources of data that we have, it will still help us a great deal in the country. We've heard from Annabelle as well, concerns around ethics and the governance structure of data, and also sharing of data across countries, and making sure that the data that is taken out of our country and the value that is realized from using those data is something that also comes back to us in some way, shape, or manner. And on this note, I'd like to call the panel discussion to a close.
Okay.